Hello everyone, welcome back to the channel. Today we have a very detailed and expansive tutorial on epilepsy, the next in the neurology series. So, epilepsy is a neurological disorder that is characterized by transient episodes of very spontaneous, intermittent and abnormal electrical activity, and this usually manifests as seizures or convulsions, which is electrical discharges. Now, there are many different types of epilepsy. There's general seizure, which has two types, tonic-clonic, which is categorized as grand mal, and absence, which is petit mal. So as I said, general epilepsy can be further categorized into tonic-clonic and absence seizures. And then there's also focal seizures. Tonic-clonic seizures are the most common type. They are characterized by loss of consciousness, periods of the muscles becoming tense or stiffening, or tonic periods, and then periods where the muscles become jerky and the patient starts to jerk, or clonic periods. And this is usually followed by a post-ictal period where the patient will experience changes in their mood or levels of consciousness. For example, they can be more confused, drowsy, they can experience muscle pain or irritability. Now, absent epileptic seizures are the most common type in children. Patients usually are described as becoming very blank and staring blankly into space and then abruptly returning back to normal consciousness. They will be unaware of their surroundings for at least 10 to 20 seconds before returning to normal. Focal seizures can be categorized further into simple focal seizures, where there is awareness is present and no post-ictal symptoms, and it can also be categorized as complex focal seizures, where there is impairment of their awareness, and there can be also the presence of other symptoms such as hallucinations, memory flashbacks, aura, déjà vu, jamais vu, and also post-ictal symptoms. Focal seizures are also sometimes called partial seizures, and they usually arise from the temporal bone and can affect your hearing, memory, speech, and emotions. There's also further localization of focal seizures within the temporal, the frontal, and the parietal and occipital lobe. The most common being the temporal lobe. This is usually categorized by automation, so this can be oral movements such as lip smacking, chewing, swallowing, so dysphagia, or abnormal movements such as grabbing, fumbling, and fidgeting, as well as complex actions such as hallucinations, dysphagia, which is disruption of speech, déjà vu, jamais vu, which is the kind of idea that they are having a relapse into a moment an event that they've had before. Emotional disturbances such as panic, disorder, anger, pain, and out-of-body experiences, as well as bizarre obsessions and delusional behaviors. Another lobe that focal seizures can localize with is the frontal lobe, which will be marked by motor features such as posturing or pendling or Jacksonian march, motor arrest, dysphagia, which is difficulty in speaking, and Todd's palsy. If it affects the parietal lobe, you'll usually have sensory disturbances such as tingling and numbness and pain. And if it affects the occipital lobe, you'll have visual disturbances such as spots, flashes, or lines. The causes, other types of epilepsy include atonic seizures, which is where there is a sudden drop of muscle tone, causing a very sudden fall, but usually no loss of consciousness. And this usually lasts up to 3 minutes. And then myoclonic seizures is when there is a very brief and sudden muscle jerking of the face, limb, or trunk, and the patient may suddenly be thrown to the ground or become very violently disobedient in one or more of their limbs. The patient is usually awake during these episodes, and the most common patient demographic is children. Infantile spasms are usually associated with tuberous sclerosis. The mnemonic HIPSY can be used to remember some of the other causes of seizures. So epilepsy is one, and other causes of seizures may include hypoglycemia, for example, in patients with type 2 diabetes mellitus or type 1 diabetes mellitus, infection, particularly HSV encephalitis. It can also be psychogenic, as well as being caused by neurological tumors, mets and abscesses in the brain, and alcohol withdrawal is a very common and high-yield cause of seizures. Now, most seizures, as I explained, have their very specific and specific presentation, but generally all seizures can present with nausea and vomiting, as well as other signs such as tongue biting and incontinence. To investigate further, we would do a series of bedside bloods and imaging. Bedside examinations include taking a full history, so asking about behaviours such as deja vu, any odd behaviours, post-ictal symptoms such as changes in mood, tongue biting, incontinence, as well as asking about triggers such as alcohol, stress, flashing lights, and doing a CNS examination. For bloods, we can check for their drug levels and alcohol levels, to check for other triggers of epilepsy. And in terms of imaging, the first line is usually an electroencephalogram or an EEG, and then second line being an MRI brain scan. We can also do a lumbar puncture if there's signs of infection present. In terms of management, firstly, we want to conservatively manage the patient by avoiding any triggers such as alcohol or stress, and helping them to relax with psychological treatments such as CBT or relaxation. In terms of medical treatment, there is a series of anti-epileptic drugs which can be used to tackle and treat the various types of epilepsy. We'll go into further detail in upcoming slides. But generally, the most commonly used drug is sodium valproate, which is used first line for pretty much every single type of epilepsy, especially generalized, tonic-clonic, absence, atonic, and also myoclonic. The exception being focal seizures, where the first line is usually lamotrigine instead. The diagram and words written on the bottom kind of summarize the first line, second line, and third line for each of the different types of epilepsy. And in terms of surgical, if the patient has severe epilepsy, we can do things like a neurological resection, vagal nerve stimulation, and deep brain stimulation. Now, in order to be placed on anti-epileptic drugs, the patient can only be commenced by specialists after epilepsy diagnosis. They must have had at least 2 seizures, and if there is a high rate of reoccurrence, the EEG must have shown signs of epilepsy or focal CNS deficiency. They're usually started on a drug by a specialist doctor, and the doses are built up slowly over 2 to 3 months. And when we stop anti-epileptic drugs, we also want to cease it under specialist supervision, and slowly decrease the dosage over 2 to 3 months. And the patient must have been seizure-free for at least over 2 years for them to be taken off anti-epileptic drugs. Now, we're now going to go through the different types of anti-epileptic drugs and their mechanism of action, indication, and side effect. Sodium valproate. This is the most commonly used drug in pretty much all types of epilepsy, except for focal seizures. The mechanism of action is that it usually decreases the activity of voltage-gated sodium channels that increases the activity of GABA. And as I said, it's pretty much used for every single type of epilepsy. It's generalized, atonic, myoclonic, absence, and tonic-clonic. The side effects can be remembered using the mnemonic valproate. Very high yield ones to remember is anemia or alopecia, hair loss, and sodium valproate also causes liver toxicity. It's a P450 inducer. It's also teratogenic, so we want to avoid it in pregnancy. Valproate can also cause tremors, thrombocytopenia, encephalopathy, and also spina bifida in children and neural tube deficits, which is why we want to avoid it in pregnancy. Other anti-epileptic drugs include phenytoin, which works by blocking voltage-gated sodium channels also, and it is eliminated by zero-order kinetics. We usually use phenytoin for tonic-clonic seizures, recurrent epileptic prophylaxis, and partial and focal seizures. The side effects of phenytoin are shown below with the mnemonic phenytoin. You can have a look at that. And the triad for phenytoin toxicity is usually signs such as diplopia, ataxia, and sedation. Other anti-epileptic drugs include carbamazepine, ethosuximide, and lamotrigine, which is kind of remembered as the 3 types of drugs that can cause Stevens-Johnson syndrome, which is an extreme rash, And we remember this with the helpful mnemonic Carl, Ethan, Larry, Stephen Johnson, which is kind of a boy band. And each name of the boy band member denotes to one of the drugs that can induce Stephen Johnson syndrome. To go into a bit further detail, carbamazepine works by increasing the refractory period of voltage-gated sodium channels. So pretty much all of them work on voltage-gated sodium channels. And it's usually used second line for focal seizures as well as trigeminal neuralgia. And some common side effects to keep an eye out is for it's also a P450 inducer. Just like phenytoin, it can lead to diplopia, aplastic anemia, and Stevens-Johnson syndrome. Efzofitimod decreases T-type calcium channels. It's indicated in absent seizures, and its side effects include Stevens-Johnson syndrome. And lamotrigine is a sodium channel blocker. It's used for generalized and focal seizures, and it also can lead to Stevens-Johnson syndrome. So Carl, Ethan, Larry can lead to Stevens and Johnson syndrome. These are some of the not as common drugs, but it's also good to know. Benzodiazepine works by increasing the activity of GABA A, just like valproate, and it's usually used more of a rescue medication in emergencies, and it can be given rectally or intranasally. And levetiracetam, mechanism of action is unknown. And in terms of some of the driving rules for epilepsy, if a patient has had a one-off seizure, or it's their very first seizure, the patient should not be driving for the next 6 months. And if they've got established and recurrent epilepsy, they should inform the DVLA, and they need to be at least seizure-free for over 1 year to start driving again. And in terms of pregnancy, most of these drugs are teratogenic, in particular sodium valproate, which can lead to spina bifida, and neural tube defects, so we want to avoid them in pregnancy. So I have a few SVAs, just have a go at these, and the answers will be shown. So this question suggests absent seizure due to the patient staring blankly into space and being quite absent-minded before returning to normal, and the first line for absent seizures is ethosuximide. This question is suggesting tonic-clonic seizures because the patient's muscles stiffen suddenly and then there's random jerking movements. She's also got a post-ictal period where she's quite confused, drowsy, and irritable. And usually we give sodium valproate as first line for a tonic-clonic seizure. However, this patient is pregnant. We know that valproate is teratogenic, so we don't want to give her that. And therefore, second line is usually lamotrigine. We can also give carbamazepine, but that's more of a third line drug. If valproate is contraindicated, for example, if the patient's pregnant, we want to then give the second line drug, which is lamotrigine. So all of these are a side effect of phenytoin use, except P450, because phenytoin is actually a P450 inducer, not an inhibitor. And ataxia, enlarged gums, hirsutism, and yellowing of the eyes or jaundice are all side effects of phenytoin. Thank you for watching so much. If you have any questions, please make sure to comment down in the section below, and always make sure to like and subscribe. Thank you so much for tuning in and listening. Thank you.